Week 4 of pregnancy is the earliest time that a urine pregnancy test or even a serum pregnancy test will actually be positive, because this is when the baby first starts making HCG, which is the chemical that's tested in pregnancy tests. If you ask what would an ultrasound look like if I was 4 weeks pregnant, the answer is your ultrasound would look like you're not pregnant, because things are really too small to show up on ultrasound. So that's important to notice, because some people will get a positive pregnancy test and for some reason they get an ultrasound and the ultrasound will look like they're not pregnant and they think the pregnancy test is wrong. It's just that you're super early. To understand what week 4 of pregnancy really means, you have to understand how we date a pregnancy. We start off with the first day of your last menstrual period, but you don't really conceive for 2 weeks later. So week 2 of pregnancy is really when you actually conceived. So week 4 of pregnancy is really just 2 weeks after conception. And what happens is it takes a while for the fertilized egg to move its way down the fallopian tube and implant into the uterus and then begin to start making the hormone. And that's why at week 4 is the first time that you would know you're pregnant. It's also when you first miss your period, because your period would come about 2 weeks after conception. And so when you first missed your period, that's week 4 of pregnancy. And that's when you're going to get a positive pregnancy test. Generally, at week 4 of pregnancy, there's very little symptoms of pregnancy, because most of the traditional symptoms that we associate with pregnancy, like fatigue and nausea and vomiting, occur because of that pregnancy hormone HCG. And at week 4, there's very, very little of that HCG being made. The pregnancy tests on the market generally become positive at an HCG value of 20 to 30. And that number is going to double every 3 days or so. So it goes up very quickly and eventually is going to peak out in the tens of thousands. And that's when you really have symptoms. So you see at week 4, you maybe have an HCG of 20 or 40 or even 100. But compared to tens of thousands, it's not enough to really give you symptoms. Now, one thing that you may experience in week 4 is some spotting, and we call that implantation bleeding, because as the egg, the fertilized embryo, is implanting into the uterus and beginning to make the early stages of a placenta, that can cause some bleeding and people will have some spotting. Now, sometimes people will mistake that as actually their period. And so sometimes people will come in and they'll be a month farther than they think because they had a little bit of bleeding that they considered a period when it really was just implantation bleeding. Other times people will know they're pregnant and they'll see spotting and they'll get very worried because naturally when people have bleeding, they're worried that they're having a miscarriage or even perhaps an ectopic pregnancy. But in most cases, there's nothing to worry about. That bleeding is just implantation bleeding. However, if you have bleeding and significant pain, that is a reason to be seen right away, even in the emergency department, to rule out something like an ectopic pregnancy. So week 4 of pregnancy is when you first find out you're pregnant. You get your positive pregnancy test. It's a good time to choose your obstetrician and call up so you can get an appointment and get things started.
Medtwice.com